I do want to move on to some other options, which is the realm of surgery. My background is initially training in otolaryngology, head and neck surgery, which is ear, nose, and throat, as many of you might know it. I then went on to do a fellowship in facial plastic and reconstructive surgery. So about half of my practice is cosmetic, and half of it is using some of the same techniques to remove skin cancers and repair people with visual defects and eyelid masses and tumors, nasal reconstruction, and sinus surgeries and the like. When it comes to surgical procedures, I like to work from the top down. The eyes are what we look at when we talk to someone, when we look at them, and I really think that procedures that I perform around the eyes can be some of the most dramatic. The brows frame the eyes, and therefore anytime I talk about eyelid procedures, I'll often bring up some changes around the eyebrows. Moving down the face to the sort of lower face and neck, a facelift or a necklift procedure can be really nice to reshape and rejuvenate the lower face. Nasal surgery, ear surgery, I'll talk a little bit about both of those. And lastly, kind of coming full circle to the skin, another common treatment I do is a laser resurfacing procedure to address the changes in the skin itself. The foundation for addressing any aging-related changes to the face is a consultation visit. And we sit down, this is where I really get to know my patients quite well, and also get to hear what specifically I can do to help them feel and look their best. It starts with computer imaging. So here's an example of a woman who came to see me, and I was able to kind of demonstrate what our goals were with the computer. Another example of that, a woman who had some changes around the lower face and neck that she wasn't really happy with, and I used the computer to give an idea of what we might achieve. And afterwards, you can see what the actual results are. And she'll come up again in a moment here. Facial rejuvenation surgery is really not just reversing aging changes or the inevitable facelift, but trying to address things at all different ages and try to keep people looking their best. There's a whole list, as I went through before, of different options and different procedures that can be performed. Beginning mainly with patients who are a little bit younger, still have some really good skin elasticity. In this woman, she was getting ready to be married, and it was a few months before that. And she really didn't like her profile, her jawline, and kind of felt there was some heaviness around her eyes. So I did some liposuction, and I did what's called an endoscopic brow lift to open up the eyes and also to refine the jawline and neck. And I think you can see how that just made her appear healthier, happier, and a bit younger. So this is a great way to really take care of some unwanted fatty deposits in the neck. Sometimes we need to do a little bit more, and specifically to address some of the changes in the jowl area and change the jawline to be a healthier, younger appearance. This is what's called a Minilift. A Minilift is a great way to reshape the jawline and take away some of these early aging changes along the neck. I often combine these, and you'll see up top some of these have various other procedures that are used in combination, such as in this woman, a fractional laser treatment for some sun damage. You can see how that really changes the neck and makes her appear and feel a lot younger. Here's the woman that you saw just a bit ago, really reshaping along the neck and in the jowl area. Here's an example where I did some liposuction in combination with a facelift, which really changed her neckline quite dramatically. And another thing I sometimes do, which I'll draw your attention to, she had worn heavy earrings for many years, and her earlobes had been stretched out. So I did what's called an earlobe reduction and made her earlobes a little bit smaller. Here's a combination of an upper eyelid procedure, which I'll talk about a little bit more. That's known as a Blepharoplasty, in conjunction with a lower face and neck lift and a little bit of laser resurfacing of the face as well. And moving up to kind of the whole kit and caboodle, as I say, this woman had both a lower face neck lift, a brow lift, and some laser resurfacing of the face. This was a really sweet woman who came down from Canada, and her mom had told her when she was quite young, build up a facelift fund. And that's what she did, and here's what she looks like afterwards. Again, please chime in if you have any questions about any of these, because I know they might pop some questions. Yes? Excellent question. So when we talk about a facelift, facelift really is addressing the lower face and neck, pretty much from sort of the level of the eyes down. The brows are a slightly different area and can be addressed at the same time, but do require some different techniques. And one of probably the biggest difference these days is many of these procedures, in fact, I'll go back just a little bit. This woman's a good example. Her entire procedure was done not completely asleep, but with a sedation type anesthetic. So she wasn't, didn't have an anesthesiologist, just got some medication similar to a colonoscopy, and came out, went home the same day, and you can see what a revolutionary change that was in her facial appearance. But again, addressing, when we say facelift, it's really sort of the cheek area, the jowls, and the neck. Occasionally, another procedure that I'll touch upon is the chin. In some people, and this was a good example of that, the chin isn't quite strong enough to support the profile of the face in other ways. So adding a small chin implant can really allow a little bit of lengthening of the neck from the front, and really allow a nice jawline and profile view to appear. Here's kind of a good example of what just a traditional facelift procedure can achieve. Here's a woman who I know quite well. She's actually the administrator in my office. She was looking at her mom, and her mom had some changes that she said, I want to kind of prevent some of those from happening. So we proceeded with a lower face and neck lift, which is essentially a traditional facelift, to really reshape along the jawline, reshape along the neck, and refine her appearance from the side as well. This is all in one procedure. Yeah, in fact, this was 5 years ago. She, 8 days after her surgery, was at this very event. This is a one-time procedure that can last for up to 10 years. At least turn back the clock about 10 years is a good way of thinking about it. That's an excellent question. So where do I place or hide the incisions? The incisions are hidden around the ears. They go both in front of and behind the ears, and I use some of those creases to hide the incisions. If you look very carefully, they're hidden right around here, and then they go up behind the ear and go into the hairline. So they're essentially invisible once they're healed. Moving on to the upper face, so the eyebrows and the eyelids. I often talk about them in conjunction because in some people, if the eyebrows have come down a little bit, it limits a little bit what I can do with the eyelids. It used to be that a Browlift procedure to rejuvenate the upper face required an incision like this that went across the entire head. Now I do upwards of 90% of these endoscopically. So using some new technology with some absorbable little fixators, I'm able to reshape the brows with minimal incisions and really minimal downtime as well. So here's a woman who kind of thought that a lot of the time she looked kind of sad and a little tired. And she really wasn't. She was quite an active and really bright woman. So with a very conservative technique, I was able to elevate the corners of the brows, open up her eyes. At the same time, I did do a Minilift. She was bothered by this neck that just kind of went. She said all of her family had a neck that went straight from her chin to her chest. And she really wanted to have a nice little neck contour. Another example of that, this woman she couldn't even relax her eyebrows enough to get a good picture of her without lifting her eyebrows up. So afterwards, here she is, nice and relaxed, and it did help soften some of the lines in the forehead, which I think you can see. Here's a great example of a woman. Now this is someone who had rather heavy eyebrows, as well as some changes of the upper eyelids, some heavy skin. In fact, insurance did cover part of this procedure because of the fact that this was now impeding her vision. In fact, you might be able to tell you can hardly see her eyes in that picture. So afterwards, you can see that really opened up her eyes, just a really revolutionary change for her, and she's quite ecstatic. In fact, she's now interested in maybe addressing some of the changes down in the lower part of the neck and face. Please stop me if any of these pop a question in your head, because The question was specific to eyebrows, but really can be applied to lots of different areas of the face. Asymmetry. It's interesting, if you take most of us and take two pictures and cut our faces in half and mirror image, you'd probably have two different faces to a certain extent. So asymmetries are very common. And often if noticed ahead of time and are addressed well, they can be corrected to a certain extent. It is really hard to completely make an asymmetric face perfectly symmetric in the end, but it is something that can be addressed with differential technique between the two sides.